The new research linking linoleic acid, a type of omega-6 fatty acid found in common cooking oils, to aggressive breast cancer is sending ripples through the medical and nutritional communities, and for good reason. While mainstream coverage of the study urges caution and balance in interpreting the findings, the underlying science reveals a far more troubling picture. When we strip away the cautious optimism and clinical detachment, what emerges is a deepening crisis in modern nutrition, one that may be fueling a silent epidemic of cancer and chronic disease through everyday foods we've been told are healthy. Let's be honest, this isn't the first time linoleic acid has been under scrutiny. For decades, scientists and doctors have warned about the imbalanced omega-6 to omega-3 ratio in modern Western diets and how excessive omega-6 intake may drive chronic inflammation. Inflammation, as we now know, is not just a vague term. It's a core driver of many diseases, from heart failure and Alzheimer's to autoimmune conditions and cancer. But what this new study from Weill Cornell Medicine has done is zoom in on a very specific, very deadly form of breast cancer, triple-negative breast cancer, TNBC, and show how linoleic acid may be acting like gasoline on an already burning fire. Triple-negative breast cancer is no ordinary diagnosis. It is notoriously aggressive, prone to recurrence, and much harder to treat due to the absence of hormone receptors that are typically targeted by standard therapies. It affects roughly 15% of all breast cancer patients, but that percentage translates into tens of thousands of women, many of whom are younger or come from underserved communities. What the study found is that linoleic acid not only supports the growth of TNBC cells, it actually activates a cellular growth pathway, mTORC1, through binding with a specific protein, FABP5. This binding sets off a cascade that fuels tumor growth, and when tested in mice fed a diet high in linoleic acid, it resulted in significantly larger tumors. Worse yet, this same pattern was seen in human blood samples from women with TNBC, suggesting this isn't just a rodent phenomenon. This is not just a scientific curiosity. It is a public health alarm bell. The average American diet is soaked in linoleic acid. These seed oils, corn, soybean, sunflower, and others, are foundational ingredients in nearly every processed food product on the shelves. They're marketed as heart-healthy alternatives to saturated fats, yet they are industrial byproducts, often chemically extracted using solvents like hexane, and then bleached and deodorized to mask their instability and rancidity. This is not food in any traditional sense. It's industrial lubricant repackaged as nutrition. And yet, many health organizations continue to push seed oils as a healthy fat source.
Why?
Because they lower LDL cholesterol, a metric that has been overemphasized as the be-all end-all of heart health, despite increasing evidence that this single factor tells only part of the story. Meanwhile, cancer cases continue to rise. Autoimmune conditions are reaching epidemic levels, and we are watching the collapse of metabolic health across the population, particularly in children and young adults. There is a toxic feedback loop at work here. The more ultra-processed foods we consume, the more seed oils we ingest. The more seed oils we consume, the more chronic inflammation we produce. The more inflammation we carry, the higher our risk for cancer and other degenerative diseases. But instead of facing this hard truth, public health officials seem locked into a narrative built on outdated science and corporate influence. And the media, often eager to soften the implications of frightening research, urges us not to panic, not to draw sweeping conclusions. But when is enough enough? It's time to ask the hard questions. Why are these oils so prevalent in our food system? Who benefits from their use? And why is the public not being given the full picture about the potential dangers? The research does not say that cooking oils directly cause cancer, but it does show, clearly and biologically, that they may significantly worsen it under certain conditions. That should be more than enough to trigger a massive public reevaluation of their role in our diets. Instead, we are told to keep eating everything in moderation, a phrase that has become a convenient smokescreen for avoiding meaningful dietary change. Let's also talk about the broader nutritional context. Most people in Western countries do not suffer from a deficiency in essential fatty acids. We are, instead, grossly oversupplied with omega-6, largely due to the industrialization of our food. While linoleic acid does serve roles in the body, such as maintaining skin and cell membrane health, those benefits are obliterated when intake is excessive and wildly imbalanced with omega-3s. And make no mistake, the average omega-6 to omega-3 ratio in the modern diet is estimated to be 20-1 or even higher, far from the 1-1 to 4-1 ratio considered optimal for health. The nutritional establishment has long ignored or downplayed the risks associated with this imbalance, perhaps because acknowledging it would implicate nearly every packaged food product in the grocery store and every fast food chain meal as a potential health hazard. But the science is catching up, and studies like this one are pulling back the curtain on what has quietly become one of the most dangerous aspects of modern eating. So no, we should not panic. But we should absolutely take this seriously, more seriously than most media outlets or public health bodies are willing to admit. That means reducing seed oil consumption drastically, not just trimming around the edges. It means cooking with stable fats like olive oil, coconut oil, butter, and yes, even traditional animal fats like beef tallow and lard, foods that humans consumed for generations before the rise of chronic illness. And above all, it means refusing to accept the half-truths we've been sold about what's healthy. The science is evolving, and the evidence is growing clearer by the day. What we eat matters, not just in vague terms of weight or blood sugar, but at the deepest cellular levels. And some of the most common ingredients in our kitchens and restaurants may be quietly pushing us closer to cancer, one meal at a time.